So first of all, thank you for inviting us to take part in this and for shortlisting us for this entry. It's really appreciated. My name is Tara Davis and I work for Manchester Foundation Trust, and I will be presenting this following our implementation of an always events during COVID-19 on a children's oncology ward. Unfortunately, the ward manager can't make it today due to clinical commitments, but all effort is given to her as well, in recognition as well. So absolutely. So can we move to the next slide then, please? So Manchester Foundation Trust employs over 27,000 staff members and provides services in 10 hospitals across a number of sites and community services. This includes highly specialised regional and national specialities, and Ward 84 at Royal Manchester Children's Hospital is one of these areas. Due to a ward move recently, they are now identified as Ward 86. So just in case of any sort of confusion or anything, so they are, although the presentation refers to them as Ward 84. So improving patient experience is a key objective of our overall organisation, alongside safety and clinical effectiveness. But often patient experience can get overlooked and it can be difficult to measure. So, how we've achieved this. So implementing always events provides us with an opportunity, but also to co-produce the improvements in partnership with our patients and families and carers. It also supports our organisational values, Together Care Matters. And we also have our experience and involvement strategy, which was developed last year in 2020, and co-production is a commitment within this. So we're really keen to ensure co-production is embedded within our organisation. Next slide, please. Thank you. So Ward 84 Children's Oncology, they commenced their participation in their always events early in 2020 and successfully implemented it later the same year, despite having pauses to the programme due to the impact of the COVID pandemic. And I'm sure a lot of you will be aware that Always Events is a co-production methodology, and it's led by NHS England in partnership with the Picker Institute and NHS Improvement. So a full framework is available from NHS England, but my presentation aims to provide an insight into the methodology applied by the ward. And Always Events isn't really an event as such, but more reflective of an always experience. And at MFT, we want to ensure we work together with our patients to co-produce improvements to ensure we know what really matters to them. And we're really pleased to say that Ward 84, stroke now 86, have achieved this. So I was appointed as the programme lead from the Trust and have supported the ward throughout the process, but it wouldn't have been possible without the leadership and the commitment of the ward manager, her ward sister and the PAC team that was developed. Okay, next slide, please. So following the methodology from NHS England, a point of care action team, who we identified as our PACT team, was developed, and this included MDT representatives such as nursing staff, play leaders, youth workers and a CNS, and patients and parents were involved in this too. And this was to take forward the pilot, and the activity of this team reported into an oversight group, which was chaired by our Deputy Chief Nurse. Engagement with the families and the patients and the ward MDT took place to identify what matters to both patients but staff members as well. And feedback opportunities were provided just via 3 simple questions, and these could be provided in a written format or from an online link or on Twitter. So it was out and about as much to share the messages as much as we possibly could. Feedback was received and reflected on to identify a theme to focus on. And the overarching feedback was extremely positive, and it recognised the huge contributions staff made to patients and families' experiences. But also identified, and it wasn't in from a negative aspect, but saying that timely communication regarding blood count results was what mattered to the families and what they always wanted to know, as this affected their treatment schedules. So it was something also that the families understood and were aware of because of the impact of the blood count results. It's something they'd sort of like learnt about, and they were able to sort of like understand this in a manner that, you know, some of the other things they might not be quite clear of because it was too clinical. So it enabled them to feel more involved in their child's care and treatment. And a written record of their named nurse for the day was also identified as important to them. Next slide, please. So the steps undertaken for the Always event. So after reflecting on the feedback, the team were able to develop a co-produced vision for the Always events with the patients and families regarding their care, which was in their voice, and what they always wanted to occur. And you can see what their vision is there. It was, I will always receive written daily updates about my child's care plan, and this will include information about which nurse is looking after me. And as a result of this, the vision was developed and then a written communication tool was identified. And we called this the patient information update. And this would provide written daily updates with the key information that families wanted to know. The aim statement was created by the PAC team. So this was to measure how they would implement the vision from the patients. And you'll see that recorded on the slide as well. And then what we did was we collected baseline data to support the change and to provide evidence that it wasn't already occurring prior to the pilot. And then PDSA cycles were commenced to test the process, just in small areas of the ward to start with. Okay, next slide, please. So the team wanted to consider how they could reliably implement the change for every patient. So to ensure the process was followed, we needed to measure that it was regularly occurring and if the Always events were being carried out as planned. So this resulted in quantitative and qualitative feedback. We also wanted to ensure it was successfully embedded into practice and happens for every patient every time. And therefore, this was included in the daily team huddles on the ward and added to the nurse in charge daily checklist. They also identified on the ward that as blood counts arrived in the early hours of the morning, the PIU could be completed for each patient by the night shift staff. And that way it was able to be distributed first thing in the morning, which supported the patients having the timely information. To ensure all the staff members was aware as well of the Always event, we undertook spot check audits with them pre and post implementation to ask if they knew about the Always event and what it was. A display board was also developed on the ward to raise awareness with both patients, families and staff members, including new staff members. Subsequently, following implementation, this improved both patient and staff experience, and the measures that we did are discussed next. So can I have the next slide, please? So the evidence measures we undertook are reflected in this slide. So this includes some of the baseline data reflected in table 1, showing that written communication of blood count results was not being provided regularly on a daily basis in both pilot areas. The PIU was then piloted in the teenage bay during the PDSA period in early October, and then extended to a further area, the side rooms, during the second PDSA. And then process measures were undertaken to record this, and they're reflected in the graph whereby you can see the increase in the areas that's recorded. So following implementation of the PIU in November, the process measures continued for a period of time up until January 2021, and they now occur intermittently. So, and that's to provide supporting evidence. A short survey to reflect balance in measures for patients, parents, carers and staff members was undertaken following implementation. And the results showed that 99% of patients or families would rate the PIU as excellent or good. Furthermore, 80% of patients' families said this was definitely useful. Okay, next slide, please. So the initial PIU, which is displayed on the left of the slide, was developed, and this included key information that's often provided on a daily basis, but also verbal information that was identified as important to patients and families. Since implementation and following co-production with patients and families and staff members regarding the effectiveness of this, the PIU was adapted to be more patient-friendly and more similar to a journal reflection rather than a form, as often families saved these for their future, as part of their oncology experience and to reflect back on. In addition, balancing measures to ensure the change had an unintended impact on the staff members were recorded. So this included workload and time, as it avoided families requesting the results, staff having to log in, print these, etc. And longer term, we don't know, but this could impact financially in terms of time management. The staff experience feedback also highlighted 84.5% of staff members rated the PIU as excellent or good, and 69% of staff members said it was definitely useful. So next slide, please. So the feedback shows that our aim was to enable the patients and families to have as much information communicated to them as possible at the start of every day that was important to them. And since implementation, feedback from the parents and patients has been really positive. So there's some examples of that shown on the slide on a small word cloud. Since implementing their Always events, the PI and their Always event PIU tool, the team on the ward have continued to sustain this. And despite their move, they have now identified as Ward 86, their PIU has been updated to reflect this. There are plans to adapt the PIU to improve patients' and families' experiences on one of the long-term ventilation wards, and other Always events are also being piloted in other areas of our trust, as we're keen to reflect the co-production methodology, which is reflected in the ambitions of our experience and involvement strategy. Just to let you know, a resource kit has been developed within the trust to support staff in other areas throughout the process. This includes a step-by-step presentation, a plan on a page, and a range of other resources specific to our organisation, but also national resources from NHS England and the Picker Institute. So just want to say thank you for listening, and big thanks to the ward staff as well for taking forward and implementing their Always events during the pandemic to improve patients' and families' experiences.